at 95% on room air.
Always an active space.
128/56.
The emergency room at Sanford Health is filled with nurses who are always faithful.
Okay, we'll see ya.
To their
I
patients.
think I knew that I wanted to be an ER nurse since I was like 10 years old. Don't ask me how I knew. I think I was just like being like hands-on. I like the human body. I like fixing it.
I'd say my big inspiration was my grandma. She was actually an ER nurse for like 50 years straight.
Coming up on 3 years of service in the Sioux Falls ER this June, Jake and Jenna share a lot more than that in common.
Me being a medic and then coming ER, very easy transition that way.
Jenna was a medical technician in the Air Force for 6 years.
Sanford does do a good job recognizing their veterans.
Jake is still serving as an officer in the Iowa Army National Guard.
And we have a lot of people who are in the Guard or in the reserves here, and yeah, Sanford is really good at honoring all that time away. They're really understanding. I think, gosh, just this last year I was gone for 5-6 months total of that year, and that wasn't an issue. Just came right back into work.
How does that make you feel?
It's reassuring.
A family atmosphere that's also taking care of his spouse in his absence. Yep, these two are married.
So how did you guys meet?
Nursing school.
Yep.
Yeah.
Nursing school.
We were in the same clinical group, which is like 8 people, pretty small, for our whole first year.
All of our clinical rotations were together.
Yeah, it was pretty much straight through.
It was pretty funny how that worked out.
Yeah, good way to just get to know each other platonically, and then kind of started realizing, oh shoot, I think I like you a little bit more than that by the end of the year. But yeah, still like him.
Thank you.
Yeah.
From nursing school at South Dakota State to crossing paths at Sanford Health.
We'll end up in the same trauma room. We'll both be working together to save somebody's life, and that's really cool. Like, not a lot of couples or nurses really have that experience of, oh, my wife is in the same trauma room with me saving a life right now, and that is really cool.
Like in our traumas and stuff, you just bank on people showing up and fulfilling designated roles, and you definitely need someone for each of those roles. So that, and then military as well, you kind of have someone in every sort of position, and you have to work together to fulfill the mission, right?
Fulfilling that duty of service to others, no matter what.
Well, I am doing a week and 2 days, so very soon we'll have a little boy or girl, we don't know yet, but yeah, I'm excited to start rolling with having babies and raising kids, and I'm looking forward to that for a little while now.
Yeah, absolutely.
Yeah, just
Yep, been a trooper.
Yeah.
She's still working along with everybody else here.
It's about coming through for the person next to you.
Absolutely, there is a connection in serving the community for sure.
A growing team at work and now at home. The Burtons recently welcomed a baby boy.
One of the best decisions I ever made, for sure. Don't regret it by any means, and had a lot in common with Jake, obviously, like meeting each other in nursing school and then both being military, and that kind of, I think, drew us towards each other. So.
With Sanford Health News, I'm Matt Holson.